the more severe and more characteristic the presentation, the easier the diagnosis. So we can be very reliable diagnosing classic presentations of schizophrenia, OCD, major depression, bipolar disorder. About 5% of the population has a severe psychiatric disorder. And this 5% can be accurately diagnosed and very effectively treated. The problem is in the mild and less classical presentations. And these are far more common. So maybe 1 in 5 Americans has symptoms that could be considered psychiatric diagnosis but are on the boundary. It's a very fuzzy boundary. It's very populous. The less classical the presentation, the less severe, the less reliability, and the less likely that treatment will be helpful. So the first thing is diagnose classic presentations quickly, treat them immediately, because the sooner you get to them, the less hardship lifetime. But when the presentation's not classical, when it's milder, very often you're seeing the patient on the worst day of their life. Mm-hmm. Whatever happens in the next week, they're going to be better. Maybe not perfect, better. A month later, they may look very different. And particularly in kids, the situation is often remarkably labile. And making a diagnosis on that first visit may completely miss the point. So the single most important lesson is take time. It takes time in an individual meeting. You can't do it in 7 minutes. And often you can't do it in 1 meeting. Often you can't do it in a month. Mm-hmm. The less clear the presentation, the more you step your diagnosis rather than jumping in immediately.